तो राइनोस्क्लेरोमा, ओके, राइनोस्क्लेरोमा 5 मार्क्स के बहुत ज़्यादा पूछा जाता है. इट इज़ अ क्रोनिक ग्रैनुलोमेटस डिसीज caused by gram-negative bacillus called Klebsiella rhinoscleromatis or Frick's bacillus. Okay, the disease is endemic in several parts of the world. In India, it is seen more often than northern than in southern parts. Okay, it is a chronic granulomatous disease caused by gram-negative bacillus, that is Klebsiella rhinoscleromatis or Frick's bacillus. Okay, it is seen in northern parts of the India, not in southern parts. Okay, what is the pathology behind it? Okay, the disease starts in the nose, extends to the nasopharynx, oropharynx, larynx, mostly esophageal trachea and bronchi. Okay, nose में चालू होता है, पूरा नीचे की तरफ आ जाता है. Mode of infection is both sex and any age. Okay, male, females, no age or sex predilection. Okay, what are the clinical factors? फीचर्स. ओके, तीन चीज़ है. अट्रोफिक स्टेज, ग्रैनुलोमेटस स्टेज, सिकेट्रलाइजेशन स्टेज. ओके, अट्रोफिक स्टेज, इट रिसेंबल्स अट्रोफिक rhinitis and is characterized by the foul smelling purulent nasal discharge and crusting. Okay, whenever you get a case of foul smelling purulent nasal discharge and crusting, बट इन अट्रोफिक rhinitis वहाँ पे मर्सीफुल एनोस्मिया था ना, उस बंदे को पता ही नहीं चलता था उसकी नाक से इतनी गंदी बदबू आ रही है. Here is the atrophic stage. Next is granulomatous stage. Granulomatous nodules are formed in the nasal mucosa. There is a subdermal infiltration of lower part of the external nose and upper lip, giving a woody feel. Okay. Nose are painless. Nodules are painless and non-ulcerative. Okay. Hard woody Haber's nose. Hard woody or Haber's nose, they are painless and non-ulcerative. Painless, non-ulcerative nodules, that is granulomatous nodules in the nasal mucosa. Okay. Next is secretral phase. This causes stenosis of the nares, distortion of the upper lip, adhesion in the nose, nasopharynx, oropharynx. There may be subglottic stenosis with respiratory distress. Okay, tapir nose. This causes stenosis in the it causes stenosis. Okay, first is the atrophic stage. Everything get atrophied. Next is granulomatous stage. They form granulomatous nodules. Okay, they are painless, non-ulcerative nodules. Next is secretarial stage. There is stenosis. Okay, first see the diagram only. Here, this is rhinoscleroma of the nose. Okay. It is painless, non-ulcerative nodules in the nasal mucosa and it spread to the your larynx, trachea and downwards. Okay. 3 stages: atrophic stage, granulomatous stage and secretral stage. First there is atrophy, second there is granulomation and the nodules, granulomatous nodules are formed, painless and non-ulcerative. Next is secretral, there is stenosis. Now coming to how will you diagnose it? Okay, we will do biopsy. Okay, biopsy shows infiltration of submucosa with plasma cells, lymphocytes, eosinophils and mucoelic cells and Russell bodies. Okay, remember everything: plasma cells, lymphocyte, eosinophils, mucoelic cells and Russell bodies. Later to what are mucoelic cells and what are Russell bodies? Okay, mucoelic cells are the large foamy cells with a central nucleus and vacuolated cytoplasm containing active bacilli. Okay, these are large foamy cells with a central nucleus and vacuolated cytoplasm containing active bacilli inside it. Okay, Klebsiella rhinoscleromatis bacilli are present. Okay, this is mucoelic cells. What are Russell bodies? Russell bodies are homogeneous eosinophilic inclusion bodies found in the plasma cells. Okay, these are the homogeneous eosinophilic inclusion bodies. Mucoelic cells are the large foamy cells with central nucleus and active bacilli with the vacuolated cytoplasm. Russell bodies are homogenic eosinophilic inclusion bodies in the plasma. Okay, they occur due to accumulation of immunoglobulins secreted by the plasma cells. Russell bodies occur due to accumulation of immunoglobulins secreted by the plasma cells. That's why they are eosinophilic, pinkish in color. Okay, causative organism is cultured from the biopsy material, that is Klebsiella rhinoscleromatis. How will you treat? Both streptomycin and tetracycline are given 1 gram per day and 2 gram per day. And given with a minimum period of 4 to 6 weeks. Okay, and repeated if necessary after 1 month. Treatment is stopped only when the 2 consecutive cultures of biopsy are negative. ओके, आप थोड़े दिन के बाद बायोप्सी लेंगे, तब नेगेटिव आया तो ट्रीटमेंट स्टॉप करेंगे. स्टेरॉइड्स कैन बी गिवन टू रिड्यूस द फाइब्रोसिस. ओके, सर्जिकल ट्रीटमेंट में बी रिक्वायर्ड इफ एस्टेब्लिश द एयरवे एंड करेक्ट द नेसल डिफॉर्मिटी. दिस इज द डायग्राम फॉर राइनोस्क्लेरोमा शोइंग. ओके, दो एरो मार्क दो दिखाई दे रहा है, दैट इज म्यूकोलिक सेल्स, और ये छोटे छोटे एरो में दे रहे हैं eosinophilic Russell bodies. Okay, eosinophilic Russell bodies, they are formed due to deposition of immunoglobulins by the plasma cells. Mucoelic cells are the vacuolated cytoplasm with the central nucleus. Okay, which contain active bacilli. Mucoelic cells. Okay, these eosinophilic things are the Russell bodies. That's it. This was a rhinoscleroma. See you in the next video. Until then, Jai Hind, Jai Bharat. Bye bye.